to the Oral Health Coalition webinar series. We are just delighted that everyone from around the country, this is what's very exciting. We're based right here in Topeka, Kansas, but we have folks from all over the country who have registered. So at the last check, it was 147 folks who are all interested in strategic and action planning, sustaining your effort. So we will begin exactly at 11:30, but for those of you who are already on, I want to call to your attention that there are two handouts that are on your opening on the second page, and we really encourage you to download those handouts while you're waiting for the webinar to start. One is a PDF version of the PowerPoint, and you will be able to take notes. CADCA was very generous in creating this opportunity for you to be able to take notes. And the other is the handbook that goes along with this webinar on sustaining our efforts, developing and building our oral health coalitions. So we'll take a few minutes, let you have time to settle in, begin downloading the handouts, and we will be with you shortly. Hello, welcome again to the Oral Health Coalition webinar series. We are delighted to have everyone join. 147 folks signed up, so we are really eager to spread all of this information, the expertise of the folks at CADCA throughout the country. My name is Marcia Manter. I am the Community Development Specialist at Oral Health Kansas. It's been my pleasure over the past year, 12 months, to work with Scope LA in Los Angeles, and then also with CADCA. I do want to call everyone's attention to the fact that you'll see on the second slide, you will be able to download the PowerPoint and the handouts, and so please do that. So look at your panel, and then you will see that it doesn't show it on the screen, but it will show it on your computer, so you can download the handout. Very thankful for the professional, energized, responsive work from the CADCA team to help us give you these handouts in advance. You will have there the PowerPoint in PDF version, so you can take notes, and you will also have the workbook, the handout that you can use with your own coalitions, and so please feel free to use it. We'll just take another minute before we start, and again, thanks everybody for being with us. Hello, and welcome to the final webinar in our series, Building, Strengthening, and Sustaining Community Oral Health Coalitions. For those of you who have been with us throughout the series of the last 12 months, thank you for coming back again. For those of you who are just joining us, welcome. My name is Marcia Manter. I am the Community Development Specialist at Oral Health Kansas, and joining me are my colleagues from the Midwest Collaborative, a partnership of 3 states learning and working together to establish community coalitions in each of our states. Patty Ulrich is the leader and project manager from Michigan Oral Health Coalition, living in the Upper Peninsula of Michigan, where it's much cooler than it is 95 here in Topeka. Cheryl Thompson-Marsh is the Michigan State Coalition Coordinator. Rachel Wolf in Wisconsin, and Doug Bowman here is my partner here in Kansas. Our initiative is funded by DentaQuest Oral Health 2020 project, and we're grateful for their continuing partnership, encouragement, and support. So here's what we'd like you to take a look at in slide number 2. This is your bar that's right side or left side of your computer. You will see that there's a place for comments, a place for questions. We will be delighted to have you write comments and questions as you go. We will be monitoring that, and we will be answering questions at the end. If we get lots of questions, Dave Chevelle, who is our designer, will be working with us in answering questions and posting them on our websites. This presentation will be recorded and put on Oral Health Kansas website, Michigan Oral Health website, and also the Wisconsin website. My name again is Marcia Manter. I am at Oral Health Kansas. If you have any comments or questions or need more information on the entire series, please feel free to email me at mmanter@oralhealthkansas.org. So now it's our pleasure and good fortune to welcome back Dave Chevelle and Renee Lux, part of the amazing training team at CADCA. This is their 4th webinar in our series, and they demonstrate incredible, comprehensive knowledge. So Renee, I'll turn it over to you.
Thanks, Marcia. Hi, everyone. I'm Renee Laux. I'm the Training Operations Manager at CADCA. And for those that haven't attended some of our other webinar series, CADCA stands for Community Anti-Drug Coalitions of America. And our mission is to strengthen the capacity of community coalitions to create and maintain safe, healthy, and drug-free communities globally. We were able to do this by providing TA training, public policy advocacy, and media and marketing strategies. And if you did attend some of our other webinar series, you will notice that coalition work can apply to coalitions with varying different missions. And so I think you'll get a nice little overview from Dave on how you can apply this to your oral health coalition. And without further ado, I'll introduce you to Dave Chevelle. He's one of our fantastic lead trainers, and you'll be in good hands with him, and he'll teach you a lot of amazing tools and things like that that you can use for your sustainability efforts in your coalition. So without further ado, Dave.
Well, good morning, everybody, or good afternoon, depending on where you are. Thank you very much for joining us for this webinar, the 4th in our series. And I just want to give a shout out to the planning team that has really put these webinars together. So for Patty, for Cheryl, for Rachel, Sonia, Tanya, and Doug, and Marcia, thank you. It's been a pleasure working with you. And for those of you that have not been able to attend the previous webinars, they are on the websites, and the webinars involve building coalition capacity, conducting assessments, developing strategic plans and action plans, and writing SMART objectives, and a little bit talking about evaluation. And as Renee said, that at CADCA, the Community Anti-Drug Coalitions of America, the process that we use is applicable, and it has been really rewarding process to be able to look at how this can be applied to oral health. So if you do go back and review those webinars that we've conducted previously, you'll see that there is a lot of tools to be able to work with your coalitions, work with your communities to address and promote oral health in your communities. So this webinar, our topic today, is really looking at sustainability, and it really builds off the other webinars because sustainability, and actually this is my favorite topic, sustainability is where we start to look at how we can sustain all this effort that we put into place. Coalitions spend a lot of time developing strategies, developing action plans, working with partners throughout their communities, throughout their states, and developing these strategies. And we know that change takes time. And so it takes a lot of efforts from a lot of people to put this together. And we don't want to, when funding ends or when a coordinator leaves or an organization may shift its focus, we don't want all our efforts to go away, because we do realize that if we're going to achieve oral health promotion over the course of a generation and achieve some of these long-term outcomes, we need to have our strategies in place and our partnerships in place over the long term. And in prevention, we always say prevention is more than just brushing your teeth once. You need to brush your teeth multiple times in order to achieve good oral health. And so we need to continue these efforts for a long time. And so this is my favorite topic, talking about sustainability, because it is about how we pull everything together. And you'll notice as we go through this and looking at the outcomes here, it's really about how we can pull everything together to be able to achieve our outcomes. Just want to check one thing here, make sure we have, okay. So when we look at our outcomes, it's really about how we're able to sustain all these efforts that we put together. So when you look at the particular strategic plans of each of the 3 states that have been involved, Michigan, Kansas, and Wisconsin, when you look at their plans, they're all about how we can achieve these outcomes in 2020 and beyond. So that means we need to be able to sustain our efforts in order to achieve those long-term outcomes. And so if you think about it, in session 1, I mentioned this, we did talk about capacity. Session 2, we talked about assessment. Session 3, we talked about planning, developing logic models, and developing comprehensive strategies. So we do encourage you to look at those sessions. And then session 4, we will be talking about sustainability. And so when you think about strategic planning and what we're sustaining, this strategic plan is another way of looking at our assessment logic models, comprehensive strategy, strategic plans with our ultimate goal of achieving these health outcomes, and we're evaluating it all the way through. It takes time to put these in place, and then it takes time as we move into implementation for these strategies to take hold in our community. So sustainability is about building the capacity to do this work, and then it's really looking at how we can sustain these efforts. And so what you'll see in today's webinar, it's really about building capacity in our coalition and sustaining that capacity. And then also, and this is pulling a lot from our fund development field, is how we can sustain it, how we obtain those resources it takes to be able to sustain these efforts. And as you will also notice as we go through here, and as Renee mentioned, that this particular material isn't necessarily specific, and you notice there's not a lot of reference to specific oral health outcomes. It's applicable to a lot of different coalitions in their efforts, because we're sustaining the work that we put in place. And so as we move to sustainability, you know what? I'm going to take a second here, and I opened the wrong slide. Excuse me here. I just want to make sure. Yes, I opened the wrong slide here, so I apologize for this. It's going to take me a second, but I'm going to close this slide. And I don't know how that happened. I opened the right one here. Excuse me here for a second. My apologies. rotate. So thank you for that. My apologies. So this section focusing on sustainability, and one way of thinking about sustainability is about, I like to think about when I talk about sustainability, I talk about building a house. If we're going to build a house that's going to last for a long time, this is what we use for a mental set. And we need a good foundation. We need good plans. We need good materials. We need skilled contractors to come in. We need to be able to build it. We need to be able to know what is the environment we're building the house in. If we're on the coast, what kind of weather we're going to have. If we're in the hot temperatures, what type of air conditioning we need. If we're in a cold temperatures, what our heating system. So it's all really about having a good foundation in place in order to make sure that we're going to build a sustainable house. The same thing applies to building our sustainable coalitions. And when you think about what we're sustaining when we talk about sustaining coalitions, we're sustaining the membership. And the membership involves the people, the volunteers that we bring on board in order to do the work of our coalition and to complement the work that all our partners are doing within the community. The second thing that we're sustaining are all the processes that we're involved with, the processes that we are doing around assessment, planning, implementation, doing our evaluation, and being culturally competent in that. So we need to sustain those because, as I mentioned earlier, as staff changes, as there's turnover within our organizations, we need to be able to sustain it regardless of who's involved. Even our volunteers will change. And then as we are implementing strategies, we want to make sure we're able to implement those strategies and keep those strategies implemented, whether they're being implemented by our coalition or we've transitioned those and our partners are implementing those. We want to be able to support all those strategies and initiatives, again, with the ultimate goal of achieving outcomes and sustaining our outcomes. As I mentioned earlier, prevention is about brushing your teeth. We don't just put these outcomes in place once, but there's always a new crop of young people. There's always new families coming into our communities who need these prevention programs. So all our programs need to be sustained over the long term. And so as I talked about this earlier, we are going to be sustaining the strategic planning process. And so our definition of sustainability that we like to talk about is a sustainable partnership or a sustainable coalition has enough resources to intervene at the community level and can maintain these resources long enough to see community level outcomes. And there are some key points to this. The first is we need to have enough resources. It takes a lot of work to run a coalition, to run an initiative, to do all this work that we talked about, assessment, planning, implementation, evaluation. So we need to have those. It's people resources, staffing resources, volunteers, as well as other resources. It takes computers and offices. And as we develop and started to implement strategies, it takes resources to do those. So we need the resources. And the other key point here, we talked a lot about this in the previous webinars, to be able to intervene at the community level, meaning we're not just, if we're a countywide coalition or countywide organization, we're not just doing this in one city or in one part of our county or in maybe a multiple county region. We need to be able to implement and have resources in order to achieve our change throughout the entire community that we define. And then the final point is that we need to sustain these long enough to achieve these outcomes. If we're working with young people or even with families of early childhood, we need to be able to sustain those throughout a child's lifetime and as they moved into adulthood. And how we sustain that is critical to be able to achieve these outcomes and sustain the outcomes for the long term. And so over the course of today, we are going to be talking about 4 elements of sustainability. And as I mentioned earlier, these elements really build on the capacity that we've talked about. The first 3 talk about building capacity. The last one, obtaining the financial and other resources required to do the work, really come from the fund development field. So it takes all of these efforts. We need strong volunteers. We need our process. We need to be relevant to the community. In order to have those, and when we have those in place, then we can make sure that we have the resources in order to sustain our efforts. And if you've ever seen the movie Jerry Maguire, if you can think about some of the sayings that come from that, one of the sayings that is, "You had me a hello." And so if we have a good, strong volunteer and membership base, and people know about that in our communities, we have credible processes that create ongoing updates to our strategies and plans. People see us as relevant to what they care about. Then when we go to funders, when we go to partners and say, can you support us? They'll say, you had me at hello. And then we can say, show me the money. And so it's really about building the capacity in our relationships with our community. Then we can go ahead and ask for the resources. So again, we've got a lot of slides here, so we'll keep moving through this. But the goal is to really look at the first three parts of this, these four things. Things are a technical term. These four things that we want to do. The first three are about building capacity and relevance to the community. The last one is building those, make sure we have resources to do the work. So if we jump into the first one, and we look at the first element of building a strong volunteer membership base, in our previous session on capacity, we spent a lot of time, the first session, talking about recruiting members, and the focus was on targeted recruiting to get the right people to the right meeting at the right time. So if you notice, those of you that have been able to download the workbook, you'll notice the first several slides there talk about community sector, community resources, and membership recruiting. Put those in here just to remind us that the coalition is about getting volunteers involved, and when we recruit them, we want to make sure that we're recruiting from diverse sectors in our community. We're looking at what resources we need to recruit people, and then we're doing targeted recruiting, which is not just putting up signs and saying, come to our coalition meeting, or putting out blast email. It's identifying what work are we doing, and then how do we recruit people to do those work. So it's about getting the right person to the right meeting at the right time. So if you have not seen that capacity webinar, I encourage you to go back and review that section on recruiting. And then from a sustainability standpoint, we can look at how we sustain, once we recruit members to our coalition or people to come work with the coalition in whatever capacity, how we sustain their and retain their membership. And this is where the 6 R's come into place. And the 6 R's, there is a worksheet and some notes if you look on pages 6 and 7 of the handouts. But there are some things that we can do intentionally as part of our, and that's what the 6 R's allow us to do, to say, are we really doing these elements? You can look at building relationships, having roles for people, showing respect, recognition, and rewards for people, and showing results. Are we really building that into the ongoing work of our coalition? So if you look on page 7, the 6 R's notes, I'm just going to walk through these quickly, but you can start to think about and use the worksheet to say, does our coalition do these things, or how can we improve the work of our coalition? Just to walk through these quickly, the first R, building relationships. When they've done research with people, they found out that our members of coalitions, why they stay in coalition and why they came to the coalition in the first place, it's usually because they had a relationship with somebody on that coalition. So the first thing we want to do is when people start showing up at either our coalition meetings or they get involved in work groups, is how do we build a relationship with them? And a lot of that has to do with just, are we getting to know people? Do we do activities at our meetings that allow people to get to know each other? Do we do activities where, do we make it easy for people to know each other's names? There's nothing worse, and some of you may have experienced this, when you show up at a meeting and you don't know anybody and everybody's talking to each other, and you don't have a way to connect with people. That's not going to allow you to build a relationship. So some coalitions, what they do, they form almost a welcome wagon. There's someone new at a meeting, an existing member will come and introduce themselves and sit with them during the meeting so they can explain what's going on in the meeting. They have name tags for everybody. They obviously let people introduce themselves. And then that welcome wagon member will also follow up with the person after the meeting, the new volunteer after the meeting, and ask them and give them a call and say, if you have any questions, how do you want to get involved? How can we support you? So it's about building relationships so that when, if I have been involved and I've got a relationship with people, I'm more likely to stay involved with that coalition. I may drop off and not be involved for a while if I'm busy doing other work related or other things. But if I've got a relationship, there's somebody I can connect with when I come back to the coalition. On the handout, there's various ways to build that relationship. Another way is that when they've done research around why people stay involved with coalitions, is that they clearly have a role on the coalition. So how are we providing a role? And it's really, how are we engaging people in work that's meaningful to them? So let's talk with people and make sure that they have a clear understanding if they're on a work group. We have an assessment work group or an oral health education work group. Do we have a job description for that work group? Do we let people know that this work group, we're going to be planning an implementation of an awareness campaign in our community targeting pregnant women so they can do good prenatal care for their, if we're going to form that work group, what are we going to, that's going to meet for 3 meetings. Here's our objectives. Here's a specific task. Here's what it takes to meet the goals of this work group. So we're really clear about what our expectations are for people. The third one, in terms of respect, this is when, obviously, when people feel respected, they're more likely to look favorably toward an organization and want to stay involved. So do we start our meetings on time? Do we end on time? Having name tags, giving people a chance to introduce each other. Having, if you will, even some coalitions do have rules of order, how we're going to operate. So if we do that, we're showing respect that we care about their time, we care about them as individuals, and we are respectful toward each other. The next 2, rewards and recognition, are people stay involved if they feel that they're getting something out of it, that we talked about with them. What's in it for me, that their benefits are being met. So reward and recognition is, for all our coalition members, what we're doing to reward them. One of them is internal, to make them feel like they're getting the benefits that they want out of it. Are we providing training such as this and other trainings for folks to be able to learn more about the field and enhance their own professional development? Are we recognizing people? Do we have a reward banquet? And there's several ways to recognize people. Just if there's a newsletter, putting people's names in it. If there's somebody who's doing a really good work for the coalition, is to send a letter to their boss or their supervisor thanking them. That can go in their personnel file. If it's young people who are involved in our coalition, are we writing them letters of recommendation? Are we giving people credit for attending trainings? And then are we doing public recognition for coalition members and leaders in our community? Then the final piece is looking at how we share our results. People want to be member of something successful. So we want to look at our long-term results. Are we seeing the indicators of oral health? Are we seeing those increase and decrease appropriately over time? Are we seeing those? So we look at surveys, we look at some of our long-term results, but we don't want to wait 1 or 2 years to see these results. So are there things that the coalition does on a monthly basis to show, here's what we've done over the last month, here's what we accomplished. We conducted this training, we had this number of people, these were some of the evaluation results from our trainings, or we're working toward getting this policy passed in our community, here's our progress toward that. So do people see that the coalition is action-oriented and working towards short, middle, intermediate, and long-term results that we can celebrate? So the whole point is, this is a lot to say that when we look at people, our volunteers, and we look to ways to keep them involved, build relationships with them, make sure we're meeting their reasons for becoming involved, they're more likely to want to stay involved with our coalition. We encourage you to look through the 6R's note page, and as your coalition, this is a nice activity to say, how can we do a better job and increase the good work we're already doing in building relationships with our coalition members? And again, around this, I would also encourage you, as I mentioned, to look back at that capacity training where we do spend a lot more time talking about recruiting and retaining members. So here's a picture of the worksheet that you may have been looking at. So to keep us moving, the second element of building and sustaining a sustainable coalition is to build a credible process. What we're looking at here is, this is what we use in the substance abuse field. This is what SAMHSA has identified as the strategic prevention framework. But really, it's just a planning process. Some of you may have seen the symbol. But really, it's just whatever planning process you're using, whether you're using a public health or an oral health process, whatever process we're using, we want to make sure that that process is sustainable and we're able to conduct the elements of a process, as you can see here, which includes assessment, building capacity, planning our efforts, using processes for that planning, developing comprehensive strategies, making sure our coalition and our partners are able to implement, that we're out evaluating our efforts, and we're doing all this, again, with sustainability in mind and with cultural competence in mind. And so what we provided here, and we did talk about this, this is what the previous 3 webinars were about. We were walking through the strategic prevention framework. A big part of building a sustainable coalition is making sure that members know we are following a process. So whatever method we use, how are we sharing that and providing training to members of the coalition so that if our staff changes or if key members of the coalition leave, that we can sustain these efforts for the long term. So this is just looking at this particular slide, and we did go through this in the previous webinars in a lot more detail, but it's looking at each of our processes, whether it's starting at the top in red, analyzing information about problem, goals, factors affecting them. That's our community assessment. So do we have people on our coalition who could conduct that community assessment? Because we don't just do it once, it may be every year or every other year. We want to revisit the assessment because things change in the community. As I said, we have young people growing up, we have people aging, and so we want to know what's happening. We have new changes to our community environment. We want to be able to continue to conduct our assessment, and so we want to make sure that we have the skills and we have coalition members who are versed in not only assessment, but in each element that you see here of our strategic planning process. So one activity that we often use is to have a coalition members even take a form such as this and say, which of these areas do we want to know more about? And so we can build into our regular coalition meetings or conduct webinars and provide training around elements that our coalition members want to know more about. Or if you think about it, there are 12 elements here of these best processes that we talk about. At each of our coalition meetings, if we meet once a year, we'll spend just 15 minutes providing information about each of these. And in that way, we're making sure that our coalition members are aware of the process and they are familiar with the steps that goes along with each process. So again, that we can sustain these efforts over time. Another part of moving, and this page is in your workbook, it's in your workbook on page 9, is we want to make sure that we're culturally competent throughout the planning process. So this is a nice tool, and it's just a reminder that we're not only are we engaging members, but we're engaging diverse members of our community, and we're learning from their diversity about what works for them. And as you can imagine, learning and interacting with diverse members of our community will vary in each element or each piece of this planning process. So when we're collecting information, there may be some members of our community that don't like filling out surveys or that don't want to be able, they're not online, so they're not going to be able to fill out a survey monthly. We need to be aware of that and find what's the best way to collect information from a group to find out what are some of their challenges around accessing dental health and what are their challenges about getting insurance or whatever the issue is. We need to be able to understand the diverse characteristics of these communities. The same goes for building capacity when we're recruiting members and planning and developing strategies. Not everybody's coming from the same place. Not everybody has the same resources. We need to look at diversity throughout the efforts. And when we do that and we're aware of that, then that helps to build a sustainable coalition. Another element of having a good sustainable process is that we're able to describe, and we talked about this at our capacity building session, session 1, is we have an org chart, and an org chart of our coalition allows us to describe to our community, and I'll put a picture of the typical coalition org chart up. And it's just being real clear for a lot of reasons. It lets people see that there is a coalition, that it's more than just this meeting I'm coming to, that there's a lot of working pieces to our coalition. Lets people know all the different opportunities they can get involved. They may want to be on the steering committee, they may want to just attend coalition meetings, or there may be different staff. There may be different work groups or committees that people can get involved with. So if they're involved with the availability, looking at the availability of dental care, then that may be, they may go to that meeting. They may not be going to the coalition meetings, but at least they know that there is this coalition. So an org chart is really about it's also about transparency, and it's letting all the members know all the different pieces of our coalition. It allows us to identify where decisions are made in our coalition, about communication, how we're reporting all the work that's going on. And when you think about it, most funders, when you write a grant application, they ask for an org chart. When you think about the reason they ask for that is they want to know where the work's being done and who are all the different actors and what are all the pieces of this group that we're funding. And so for sustainability purposes, an org chart is important not only for grants, but also for going out and even raising money in the community, and we'll talk about that later, is people want to know, where's my money going? I'm making an investment in your organization. Are you organized well enough so that you will be sustainable, that my money's going to be put to good use? If it's just a collection of 8 people that get together, that may not give me, as a funder, a whole lot of confidence that the money will be used wisely. So this will, again, allow us to be able to just demonstrate how we're organized as a group, as a coalition. And so that's another aspect. So we've got our process, which is how the work will be done. The org chart describes who will do the work on the coalition. And then the third piece is developing a timeline, which describes when the work will be done. So it allows us, as you can see here, to schedule our efforts, distribute our work. And as I mentioned before with the org chart, it's also about sustainability and meaning and transparency, meaning can people see all the work that our coalition is doing? And one way you can look at this, I'm turning to this next slide, it just looks at a generic timeline. But if we can look at it in terms of the work the coalition's doing, the SPS tasks are the strategic prevention framework, the planning tasks. So when do we do our assessment? When do we do our planning? When do we do our evaluation? When are we going to be implementing strategy? That's the second one. So if we look at all the strategies the coalition is involved with, we can look at those over the course of a year. If we have different funding and we're getting different grants, we're going to be making certain applications. We need to know when those are in place. And then finally, we can look at what community events. Are we going to health fairs? Are we supporting the schools in some of their efforts? Are we meeting with parents? So we can look at all those community events that we're involved with. So when you look at coalition completes this, you can start to look at all the work it takes to run a coalition. So for recruiting purposes, it's helpful because people can see where they can get involved. The spring may be a busy time for them. They want to get more involved with the summer or in the fall. It also says that if you do have staff or you have a few key people that they may not be paid staff, but they're leading the coalition, it also shows when it's completed all the work that needs to be done, and it's too much for 1 or 2 people or 1 or 2 organizations to do. So it really lays out the need for having more members of our coalition. And then for sustainability purposes, it's also nice to have an annual timeline, because then at the beginning of each year, you don't sit down as a group and say, okay, what are we going to do this year? We've already got a precedent. We've got a timeline in place that says, well, January, when we get our survey results back, that's when we start our assessment. We revisit our strategies and action plans, and we move to implementation. So the timeline allows us to be able to continue our efforts. And again, as I've mentioned before, as staff changes or there's turnover among volunteers, if I'm a new volunteer to a coalition, I want to look at the org chart. I want to look at the timeline and say, okay, what have they done in the past? This gives me a history of what the coalition's done. So when you think about it, when we have our process, that's what work we're doing. When we have our org chart, it's where the work is being done on the coalition. The timeline is when the work's being done. When we have those in place, it really allows us to be able to sustain the coalition over the long term. Each year, we don't have to reinvent the wheel. We can build off what we've done in the previous year. So that is the second element, a credible process of building a sustainable coalition. The third element of building a sustainable coalition, and again, when you think about these first 3, as I mentioned earlier, these first 3 are about building the credibility in our community, building the credibility among our partnerships, building the credibility among current and potential future funders about what the coalition is all about, what the coalition is doing. So this third element is saying, okay, we've got good members, we've got good processes. Do people even know what we're doing, and do people see what we're doing is vital to what they see and what they see are concerns in the community? So first thing that we do, and we talked about this in our previous session on capacity, is we want to make sure, and also in strategic and action planning, we want to make sure that we have a clear vision and mission statement. So again, these Renee read CADCA's mission statement earlier on in this webinar, and that clearly defines what is CADCA doing, what is CADCA trying to do. So as you can see, the vision statement talks about what is our view of the future, because if we're going to become relevant to the community, people really need to understand what it is we're all about. Mission statement is how we go about doing it. We provide resources, we provide information, we do advocacy, we bring people together. So this is, you think about it, mission statements are about verbs. What does the coalition do? So these are vitally important, because if we're going to be making a presentation, or one of our members is making a presentation before the Rotary Club, or before the Elks Club, or to a school PTA, or to a group of dental health providers, or to the healthcare community, they need to be able to clearly and succinctly state, what does this coalition want to accomplish? How is the coalition going to do this? The mission and vision statements allow us to do that. So here's our chance as part of sustainability to revisit the vision and mission, and to really be clear that, yes, this really does convey what our coalition is doing. The next part of building our relevance to community concerns is really reach out to members of our community. We talk about cultivating community leadership. It's really cultivating community leadership and letting them know what the coalition is doing, what we're doing to promote oral health within our community. So we want to reach out to say there may be some things that we have common root causes with various if there's groups working with family health or family planning, or around substance abuse, or around domestic violence, even anything, school literacy or school promotion, any other group in the community, there may be some common factors that we can work on together. We can show how our issues interact. They are all, some people call these synergistic issues in our community. They're all interrelated to each other. And so what this allows us to do is to reframe our issue, which is oral health, in ways that can relate to what they care about. So if people have good oral health, again, it helps their ability to be employable. They'll have be able to make good presentations of themselves when they go to look for jobs. So that relates to people that are in the workforce development and training. There may be slight connections, but if people see the relevance of what we're doing, it allows us to align with them and let them know that we are an important player in this community, and that if the Oral Health Coalition is going to be going away, we want people to say, no, it's too valuable to our community. And we need to be able to show how we're valuable by communicating our outcomes in a relevant way to people. So just if you go to page number 10 in your workbook, you'll see that there's a nice way to conceptualize this. And one way is to look at if you look at the first column, we can look at what problems do people care about in their community. And this can be anything. It can be about employment. It can be about healthcare. It can be about violence. It can be about drugs or the opioid epidemic. We even get people saying, okay, it's about potholes. I care about potholes in our community. Then what we can do is to say, how do these problems relate to it says substance abuse here, excuse me, it should say oral health, but how does this relate to oral health and what we're concerned with? And so, for instance, if people are concerned about jobs and employment, well, there's different aspects that oral health plays into them. So we want to, and potential employees want to look to their employers and say, am I getting dental health coverage? Does this employer provide this resource for me or this for me? Employers care about keeping their employers healthy, their employees healthy, and they want to make sure whether the employees are dealing with their own dental care or maybe dealing with family members' dental care. And we know that dental care relates to other health issues as well. So employers have a big stake in making sure that their employees have good dental health, and prospective job development, job workforce development. Make sure, as I mentioned earlier, people make good presentations, so they care about people having good dental hygiene. Also, insurance companies, and they care about the dental health that they're providing. They're our partners on this, so they see a role for dental health in the community. And also the dental health provider community, they have a stake in this. And again, both in their employees who are looking at how people care about jobs and employees. So they want to make sure their employees obviously have good dental health practices. But then we can ask not only how do these relate to our example here, how jobs and employment relates to oral health, who cares about these? So when we talk about who cares, it's about employers. It may be the Chamber of Commerce. It may be the Rotary Club. It may be insurance providers. And then for each of them is we can think about how we can relate to them in words and language that is relevant to them about what we're doing with oral health. So it's about expanding our outreach to people that may not necessarily think about oral health. And the example I gave was in jobs and workforce development. And so let them know that what we do makes a difference about what they care about. It may be a small thing, but we are important to their community. And then if you look on page 11, there's a targeted communications worksheet. That worksheet just allows us to say, if we're going to be communicating to people, what do we need to, what questions will they have about what we're doing, and how can we make sure that we're providing information and data to them in a way that's relevant? We're providing it in an effective manner. The whole point here is, in order to be sustainable, I'm going to go back to the previous slide, is we really want to make sure that we're reaching outside of our regular coalition members, reaching out to diverse elements of our community, and letting them know that dental health does play a role and does impact them, and that the work that we're doing and the work of the coalition is vital to having a healthy community. Some of you may be asking, okay, how does potholes play into this? If people care about potholes, well, politicians care, because if the city government or the county government is paying less for their employees to be being sick or for dental health insurance and for addressing dental health issues, then there's more money in the city governments to be able to fill potholes and provide other community services. So even something as remotely as potholes can have an impact. People who care about that can be impacted by the work we do with oral health. So that's the third thing that is important for coalitions to sustain. So when you think about it, if we have good volunteers who are concerned and committed and have relationship with our coalition, if we have a good transparent process that all our members know about, and we're repeating it on an ongoing basis, we're able to implement assessment planning, capacity implementation over time, and we show that we're relevant to the community, that we're making a difference in the community, then this gets back to show me the money, or you had me at hello. Then when we go out and we ask people to provide financial and other resources to do the work, then we can, we're a credible organization that people will want to make an investment in. So that's what we're going to do, is to take a look now at how we can build the financial and other resources necessary to sustain this work. And so as I mentioned, the first three, just a summary, the first three are really about building coalition capacity and outreach to the community. The fourth part that we're going to jump into now is really about, based on fund development, how we go about thoughtfully developing a plan to sustain our coalition's efforts. And so there are 6 steps in this process, and you can read here, it's looking at first, what do we want to sustain? How much resources does it take to do our work? Then we want to be able to say, what will it take for us to do this work in the long term? We look at our resource needs, then we can look at what are some diverse funding strategies. We don't want to rely only on one funding source or one grant. What are diverse funding strategies? Then we can say, once we develop a funding plan, we can identify who are potential sources and donors that we can start building relationships now so that we can obtain resources and ask them to make an investment in us in the future. We talk about creating a case statement and then developing action plans for what we're going to do next. And so the first thing we want to do is to identify, this first step is what must be sustained. And here we can look at both sustaining our coalition, but also sustaining any specific interventions or strategies that we've been involved with. And so we can look at what does it take to run, and here's where you just need to say, if some of your coalitions may be all volunteer coalitions, but that takes time. How much time are people putting in? Is it a full, if we were to go out and obtain funding, would it be a full-time for the work that we're doing? Would it be an equivalent of a full-time work or a half-time or 2 full-time work? So what does it take to sustain our efforts? And when you think about implementing strategies, the strategies we're doing now, how much effort is it taking? How much cost is it taking to implement these strategies? And so we need to just get our arms around what does it take to do the work that we're doing now. And so we can look at 2 elements of this, is looking at both what are our current funding sources, and this we're looking at both dollars and in actual dollars and in kind. And then we're also looking at, you may or may not have a budget if you're all volunteers, but what does it take to run our coalition? And if you look at on page 12, there is a sample of a budget. You can look at it. The time would be the staffing. But if you were to develop a budget for what does it take to run your coalition now, you may come up with a certain amount of money, especially when you include that in-kind volunteer time. If you don't have paid staff, then you can say, okay, we have all these volunteers who are putting a lot of effort in. If we put a value on their time, it takes a lot of effort. So it may be 20,000, 30, 50,000. But what does it take to run our coalition now? And we can look at what are our current funding sources. So for sustainability, why we're doing this is to be able to say, based on this amount of resources, currently we can identify how much activation we're actually getting. We've got all volunteers, and we're able to be putting on three workshops a month. We're able to be doing this level of advocacy. So just getting our understanding around, again, what resources we have, how much work we're doing. That's the first step. The second step is then to identify what are potential future needs. And this is, for some coalitions, it's a real challenge to start think about if we are going to be obtaining and doing this work over the long term. And we like to think 5 years out, again, because prevention takes time and we need to continue brushing our teeth, is what do we need to sustain our efforts over the next 5 years? So you can think about it, what will your coalition look like in 5 years? So this is an important decision, and it's important to engage a variety of coalition members in, because it's really about not only the details of this, but how our community will be committing to sustaining the coalition and owning the coalition in 5 years. So it's who's going to be our leaders, how are we going to sustain those leaders? What sort of strategies, if we're a county-wide coalition, are we going to be implementing strategies through every city, every town, in our county, if we're a multi-county? How are we going to be sustaining this and doing work throughout the entire community that we've defined? How are we going to sustain our membership? It means putting together a budget for 5 years. And it's also starting to think about if we want to achieve the change, if we're going to be working with policy issues and potentially putting in new legislation or working around administrative procedures, that requires dedicated organization staffing. So in 5 years, and it's not something we're going to be doing tomorrow, but in 5 years, how much do we want to have staff? Do we think if we're going to be doing strategies throughout our county and doing trainings, working with schools, working with all the health providers throughout the county, do we need staff to do that? Are we going to need to have contractors to be doing that? It's really taking a look at our 5-year planning and say, what do we want to have in place? Then what we can start to do is say, okay, if that's the case, how much resources, both in-kind and dollar cash resources, do we need in 5 years? And so we can start to look at it from a budgeting perspective. Another way to look at it just in general is to start to say, if we're again, and this is, I just used $200,000 as a starting point. If you're at $50,000 in-kind in cash now in 2017, you may be at $10,000, but it allows your coalition members and coalition leaders to say, if we want to achieve the level of activation that we want and to be implementing all the strategies and policies and training we want in 5 years, do we need to get bigger? We think we can stay the same with our current level of resources, or no, we think we're going to be providing a coordination services in 5 years. We're not going to be doing that much, so maybe we can even get smaller. But this is, again, as I've mentioned, a chance for your coalition to be able to have that, you were soul searching, but really are planning about what we want to look like in the future. And the goal of this is to come up with a ballpark number. And again, some people may go back and come up with our budget for in 5 years for 2022. That seems so long from now, but it's not. But what is it we want to achieve in terms of resources for 2022? So you may come up with a ballpark number. It might be 50. As I said, it may be bigger, the same, smaller. It could be 50,000, 100,000. But what is this amount that we want to achieve to run our coalition in 5 years? Which then brings us to the third step, is where we select our funding strategies. And this is where, once we come up with a future funding amount, it may be, again, the numbers will depend upon your community and your what you think the future looks like for your coalition. But it may be 50,000, maybe 100,000, maybe 500,000. Whatever the amount is, then we can start to look at, okay, if we want to achieve that amount in 5 years, what are some of the funding strategies that we can start to build toward so we're able to achieve that amount in 5 years in the future? So if you look on pages 14 to 17 of your handout, we identify 17 different ways, and we use this a lot with our substance abuse coalitions, 17 different ways for coalitions to look to develop a diversified set of funding resources. And this doesn't mean you have to do all 17. Some of these may not be appropriate for your coalition, but we want to be able to think outside the box about what it takes to achieve diversified funding. And so we divided these into 4 different categories: charging, sharing, asking, and earning. And what I'd like to do is to walk through these fairly quickly. You can look at the notes. The point is, we don't want to rely on any one or any 2 sources. We want to develop a diversified set of these, and that may be 4 or 5. So we're looking at getting 20% of our resources for fundraising, 20% by grants, 20% from another source. So I'm going to walk through these fairly quickly, but just to give you an idea about all the diverse ways that coalitions can obtain resources. And again, these resources may be in kind, these resources may be cash. So the first one is where we're sharing. We're asking people to share with our coalition. And so sharing has to do with, it may be an office space, and so asset sharing. So it may be as simple as, right now, we don't have office space. We're working out of someone's home, or we're working out of our public health department. But maybe we see that we want to have a presence in the schools, or wherever we want, is to really build a relationship with potential folks that may be providing now or in the future office space for us. If we know and we have plans for, we're going to have 2 staff. That's our goal. Okay, we need office space, not now, but in 5 years, to house those 2 staff people. We want to be able to look at all the supplies, so maybe our United Way or the health department. We can make sure we're building relationships with them so they see the value of what we're doing, so they'll either start or continue to support us in ways that they have. In-kind contributions, that's all the volunteer time that people are making. We want to make sure we're using the 6 R's to make sure our volunteers are sustained so that we can sustain the level of work. And if we're going to be increasing our level of work, then we need to make sure that we're doing the efforts it takes to do more outreach to get more volunteers involved. And finally, leverage share positions. This is where an organization sees the value of your work, that they're going to say, hey, I really like this coalition. I'm going to contribute some part of FTE or a whole FTE from my budget to support this. So it may be a health department, or it may be an insurance company even, or it could be a school that sees the value. Who knows where it could be? This is in your community. It's an organization that sees the value that will want to dedicate some portion of someone's time to your oral health coalition. So again, this is ways of thinking potentially outside the box on how we're going to look for our partners and look for resources in our community. In this case, looking at asking them to share their resources with us. The next way that we do, and this is where coalitions charge. And a lot of coalitions are thinking, right now, we can't charge. We're happy to get people to show up at our, so we can't charge. But if we think about down the road, how we can really start to ask people to designate funding and to identify funding that they will provide to us. So it could be if we're providing wonderful trainings for organizations, we can charge a fee. If we're providing training for our insurance company, providing changes for providers. If they see the value of what we're doing, they may want to provide some fees for our training so we can become self-supporting in some of the trainings that we're doing. Another that may not approach is fines or penalties revenue to prevention. In our substance abuse field, again, some coalitions, there's fines for driving while intoxicated. We can receive some of those fines. I've been trying to think about in the oral health field what may that be, but there may be some fines from health department violations. We can get some of that funding going to oral health. Or if there's other sorts of any sort of penalties for folks, we can look at that. It may not be appropriate in the oral health field. The next two line items in a government budget or line items in a nonprofit budget, this is where if organizations or city governments or the health departments, if they see the value of what your coalition is doing, to put a line item in their budget to fund the coalition. And for example, if you're a county-wide organization, if you can get the health or the human resources or social services, if you've got, say, 10 cities, and if we get these 10 cities to each put, I'm just picking a number out, $1,000 or $2,000 annually toward your coalition, that's $20,000 a year. That'll pay for a lot of resources in our coalition. So it's getting them to say, we may start with a $0 amount. We're just going to put you in as a line item. 5 years down the road, and they'll say, hey, this coalition's going to go away unless we support it. Let's put it in our budget. Or United Way, or there may be even a insurance company or some health provider that'll see the value of what you're doing, have them put it in their budget. Another could be membership dues. Coalitions, as I mentioned, right now are thinking, we're just happy to get people to our meeting. But again, in 5 years, if people see the value of what we're doing, they don't want the coalition to go away, the membership dues can be on a sliding scale, but let's look at how we can start to bring in some revenue through members that value the work that we're doing. Then finally, acquire tax revenue. There are a lot of communities that are starting to levy a soda pop tax, if we can do that, if that's appropriate for your communities. Or if there's other taxes that are related to our work, can we get a portion of that, even 1% of a soda pop tax? That could be if we work with them, people see the value of what we're doing, then the people who are making those decisions about how to allocate those resources, they can say, hey, if we want to look at the impact of, I'm using soda pop as an example of those taxes, we want to decrease the impact of soda pop, oral health and dental care is a wonderful place to support that effort. So this is looking at how a coalition charges. Another way to keep this moving is looking at asking, and this is more the traditional fundraising, but here's where we can start to really look at what grants, and there's some wonderful databases out there, the foundation.org, there's lots of different organizations that have lists of different grantors who fund different elements of our community or different topics. And so we can look to grants, local, state, and national grants, both federal and private grants, foundation grants, and how we can, again, here's where we don't want to become solely reliant on any one grant source, but how we can look at diversified funding to get both not every grant funds infrastructure or coalition capacity. Some may fund specific strategies. So we can look at we can look at grant sources for that. Another way is to do a fundraiser. And here's where, for fundraisers, they can take a lot of time. So putting on a golf tournament or putting on a roadways or putting on a bake sale, that takes time. So when we look at fundraisers, we want to make sure that we're able to get enough money back from it, from the effort we're putting in. A good way to do that is if there is somebody who's already putting on a fundraiser, someone's already putting on a golf tournament, and we say, hey, can we partner with you? And we'll bring in, we've got 100 people on our rosters that may not be members or aware of your golf tournament. We'll bring them on board. Can we get a portion of your fund? Or other fundraisers where people have Wednesday night downtown in your communities may be slow for some of the restaurants, where they will have a family dining night. So, family dining for oral health. And so those restaurant owners may donate 5% of their non-alcohol sales or for your coalition. It's a way of getting people out into the community, and it gets more people on a slow night. So there's lots of ways we can do these fundraisers. The key point about these is make sure that the coalition is not putting all their effort into conducting fundraisers and not doing other things. The last three types of fundraising strategies are really more sophisticated fund development, where, again, you need to be a 501c3 or have someone who has access to a 501c3. This is where, if people see the value of our oral health coalition, that they will want to make a donation to it, whether through individual giving or through United Way, if your community has that sort of payroll giving. And real sophisticated is when there are wealthier people in your community who see the value of what you're doing, they will donate a portion of their estates to or engage in plan giving towards your coalition. These last three are a little bit more sophisticated. But again, if we want to become a real robust coalition in 5 years, we can start working toward building this sort of fund development capacity. The last one is earning. Walking through these 17 this is typically what I'll say substance abuse coalitions don't do that much. But we do know, and oral health coalitions, this may be something they are involved with or not. When you think about Salvation Army and St. Vincent de Paul, they run for-profit businesses selling clothing and selling used goods. So can we get involved in some of these for-profit business planning? You may have people on your coalition who are really good at planning. We can hire ourselves out as consultants with the revenues coming to the coalition. Or if there's another organization that's putting together a for-profit business, we can partner with them. And these are not typical coalitions, but they can be something to consider if the opportunity arises. Thank you for your patience on that. The whole point of this is there are 17 different strategies, is to build a funding pie that says if we want to raise 50,000, 100, whatever the amount that we want to raise, how are we going to do this? And we don't want to have 17 slices of our pie. This example here shows 6 slices. For each of these slices, we will develop a separate funding strategy. So when we go to grants, we're going to write a strategy and do research to find out which grants we're going to be writing. If we're going to do local fundraising, that's a whole strategy. What's going to be our local fundraising? Are we going to go to local businesses? Are we going to go to other oral health providers? Who are we going to go to in our local community? Are we going to go to parents? Organizational budgets, that's being a line item. Fees for services. So again, depending on knowing our community, how much money we need to raise, we develop a funding pie that says, here's how much we want to raise from each of these sources. And on 18, there's a pie chart where you can fill in. This is a nice activity to do with your coalition to say by 2022, we want to raise $50,000. We want to raise $100,000, $10,000. What are these different? We can either use dollar amounts or percentages. How much do we want to get from 3, 4, 5 different sources? So this becomes the basis for your sustainability funding plan to say, for the 4 sources that we've identified, what's our strategies to go out and utilize those sources as a way of obtaining funding. So that's the third step, is to identify, again, we've identified what we want to sustain. I'm going to go back. We identify what we want to sustain. Then we can look at how much we need. Then we can look at different funding sources. And then, as I mentioned, for each funding strategy, we can develop as you can see here, who might be potential sources and donors, and then we can start to identify specific steps. So this is step 4, where we're identifying potential sources and donors. And we're starting to say, who might we reach out to? If we're going to be doing a fund development campaign, if we're going to be doing, working with city councils, we need to start building relationships with each of the 5 or 6 or however many city councils there are in our county. But starting to really identify for each slice of our funding pie, who we need to start building relationships with. So here's where we talk about starting with a handshake, not with a handout, meaning we're not going to go to each city council and say, hey, we need $5,000. No, we're going to start going to each city council and say, hey, this coalition is out here. It's composed of concerned citizens and oral health providers and insurance companies, members of our community. We just want to introduce you to ourselves. And you can do that with any potential funder, any grant organizations. I was working with a coalition when I was a coordinator in Massachusetts, and there was the Western Massachusetts Foundation. We used to invite them to our meetings, send them our flyers. And then so finally they came to some, but we maintained a relationship with them. Finally, we got a call from them saying they had a specific grant they were putting out. They couldn't fund us directly, but they thought we would be a good fit for that particular grant. So in that case, we had built a relationship with them. They reached out to us for potential funding opportunity. So it's about, again, starting with the handshake is building relationships with potential funders. If we know we're going to be working with the business community, want to obtain funding from them, we need to start letting them know what we're doing, letting them know what are some of the things that we're doing that impacts them. And so this is just from the foundation directory, and the website is there. I encourage you, if you just do a Google search on the Foundation Center, there's a paid portion, but there's also a free portion where you can go and identify who are the different, and it says, are you funding infrastructure? What is your field? There's different criteria, but you can see in your community, in your state, that there's potential funders out there that are funding what you're doing. I was doing a more detailed training where we were looking at this website, and one coalition found that there was a foundation in their community who the sister of one of their members was on the board of that foundation. We already have a relationship with them. So this is a real nice way to start to build, find out who's already funding. And this is looking at potential grants and foundations. Another way of looking at this is a sector involvement form, a member coalition involvement. But basically, we can start looking at members as potential donors. Again, a lot of coalitions don't think this way, but we start with the outer, which is our overall community. But as people become more involved with the coalition, whether they're a provider or a member or the recipient of the coalition services and are recipient of some of the strategies that we're involved with, they are potential donors. And not now, but down the road, if they see the value of what we're doing, then we can start to reach out to some of them. So keeping a list of anybody who's ever attended any of our trainings, anybody who's ever attended a meeting, they can, even if we're asking people to make a $5 donation, if we have 100 members, that's $500, that's a start. Again, we can look for different members to make different kinds of contributions to the community. So the whole point here is we need to be able to looking at everybody who's involved with oral health as potential resource providers. This is critical. You may be thinking, we're just trying to get people to join, but after 5 years, and I keep going back to this, if we've done a good job and we are seen as a valuable organization in our community, then people will not want to see us go away. They know the value of what we're doing. We've had them at hello. They'll be able to show up the money because they see the value of what we're doing. So, which brings us to the next piece is we've identified what resources we want to obtain, how we're going to obtain them, we've identified some potential sources and donors, then we want to start to build a potential case statement. And so a potential case statement is our statement of why our coalition should be supported, whether it's through cash donations or other sorts of donations. And so as you can see on pages 19 and 20, we have a case statement worksheet. The case statement worksheet asks all sorts of questions about and if we can't answer these, then we need to spend time thinking about these. So why is our coalition needed? And this is based on our community assessment, but what is the oral health problems out there? What sort of periodontal diseases are out there? What is the state of oral health in our community? Why do we need a coalition? And then the second question is specifically, how does the coalition make a difference? We need to be able to, we need to be able to state, these are our strategies. This is what our coalition does. This is based on our mission statement. Here's how we make a difference in our community. And then the third question asks, what is unique about our coalition? And because if we can't say what's unique about it, then why should we ask people to make a donation? Why should we ask people to provide resources to us? Then looking at the second page is who's involved. This is building credibility by saying these are all our partners. These are the people that are committed to doing our work. Is it cost effective? We may not have actual dollars, but we do know that prevention is cost effective. We know that the work we're doing does result in better health outcomes. So we're able to say that your donation, whether it's dollars or time or in-kind resources, does make a difference. Here's how we spend your resource, your investment wisely. And then finally, when we're working with a specific donor, we want to customize this is a sales pitch. That's what it is, how we can customize any sales pitch to a particular donor. So this is a real nice worksheet for as we're starting to make contact with potential donors, potential investors in our coalition, to make sure we're able to clearly state why we're out here, how we make a difference, what we do is unique, why we're worth investing in. That's really what this is about. So what we've been able to do is we've identified what we want to sustain, how we're going to sustain it, potential sources and donors, what we're going to say to them. And so that's I didn't mention I do live in Portland, Oregon, so I can say this. That's about getting our ducks in a row. What the last step of this is, our action plan is to say, what do we need to start doing now so that we can start to make sure we are able to obtain some of these resources in the future? So do we need to start building relationships with potential funders? Do we need to start public awareness campaigns, letting people not only know about oral health, but know about our coalition in our community, how we can have contact with potential donors? So starting to connect, and we can customize some of these communications. So it's really talking about what we need to do now if we are still going to become a 501c3 in the future. We need to start thinking about having a board of directors that will be a fundraising board of directors. So it's really about, for each of our slices of our funding pie, what we need to start to do now to put in motion obtaining those resources in the future. And again, connecting with potential donors who we need to start doing a handshake with, again, with the notion in the future of them potentially supporting or investing in our coalition, in our effort. So when we pull all that together, we can pull together a sustainability plan. And this is where it's a nice tool for our coalition to have. When we provide our trainings to coalitions that CADCA provides, this is one of our required products. Basically, it's saying, what is the standard, just pulls everything together that we talked about. The case statement is, why do we have a strong coalition? What are our future resource needs? What's our funding pie? What might be some of our specific strategies to start building toward some of those future funding sources? And then action steps, what do we need to do now? And we do provide, this is an example of it's a fairly generic but sustainability plan. And it's just talking about each of those elements. And for those of you that have done this work before, you'll know that a case statement is longer than one paragraph. Case statement can be multiple pages describing, again, what our coalition does, what is the problem we're going to achieve. This is a summary plan that allows us to really put in one place all those elements that we've talked about. You can see if you go under sources and strategies, so how we're going to be raising those sources, and then what's our action plan that we're going to be doing for each of these sorts of strategies. So what we're going to do now is start potentially receiving funding from those different strategies. And so one of the last pieces here is, as you can see, that as I mentioned, the first three elements are about having a strong coalition. The last element is really looking at the dollars and cents, really putting a fund development orientation on our work. And for coalitions, again, when you're starting out, this may not be what you start with, but as you are moving in and start really want to take sustainability seriously, is to develop a fund development orientation. And so here, as you can see here, it's to get our coalition leaders to make a commitment to, yes, we want to pull this sustainability plan together. You may create a sustainability or fund development work group. And here's where we might start bringing in people who may not have been involved with our coalition, but people who are familiar with fund development. So go looking at some of our United Way, start looking at different funders in our community, start reaching out to them to get their input. There are people that do this for living, fund development. We want to really start to get expertise on board to support us in this fund development effort. And finally is to start, maybe potentially start looking at board members, our leaders, to start maybe not asking for money yet, but doing some of that outreach. If they're board members, they're influential people, get them to start doing some of that handshaking with potential donors. Not asking for funding, but really getting them in the role that, as a supporter, as a leader of this coalition, I'm going to need to be involved in this effort to start to outreach to potential sources and donors. So with all that, pulling all this together, you'll see on the last page, on page 23 of the handouts, there is a coalition sustainability checklist. And this is everything that I've covered over the course of this training, allows us to just say, what do we have in place? Yes, we have it in place. Sort of do not, may not be applicable, or we don't know, but it's a nice tool to say, are we doing these things? We talked about the 4 things. Building a strong volunteer membership base, credible process, relevance to community concerns, financial and other resources, and finally, building an organizational commitment. It's a checklist or even a worksheet to say, what do we need to do to move toward building sustainability? And then we can use this to say, okay, given all this, what do we need to do first as our coalition starts to really take on sustainability as an effort? And the final piece here is just to provide resources from CADCA and others in terms of supporting you. And CADCA does have a very strong coalition development and technical assistance manager, and she can support you whether you're a substance abuse coalition or oral health coalition. She can support you and get you resources that you need to support you in doing your work. With that, thank you all for bearing with. We did cover 57 slides in a little more than an hour. It is a fairly in-depth process, but I hopefully been able to provide an overview of what does it take to build a strong coalitions and then start to build the resources necessary to sustain that coalition. So with that, we do have time for any questions or comments that people want to make. I'm going to turn it back to the checklist.
Dave and group who are on this call. This again is Marcia Manter with Oral Health Kansas, the coordinator for these programming for webinars. Dave, we did not have any questions. I think I would just like to offer the first comment of thank you. You have worked for many years with coalitions, working to build and in fact providing leadership to organizations. Over the series that you've given us, we have so much depth of information. And this last one was particularly useful. We think about it just from the standpoint of Oral Health Kansas. We are 14 years old, I guess. And so we are at a stage of growth and realigning and reaching out. So thank you very much. I had a number of personal emails to to M. Manter at Oral Health Kansas. Where are the handouts? The handouts are on the toolbar. If you look to the right of your computer, you will see the toolbar, and there'll be a blue horizontal line that say handouts, and you can just click on those. At the same time, please feel free to write me. We have a very short 2-minute evaluation for you to to take right after this webinar is completed. If you will do that for us, please do. And again, feel free to write me with questions and comments, Marcia Manter at Oral Health Kansas, and I will forward those to Dave. We will be able to respond to you. So thank you, everyone. I do want you to know that we're going to take a breath 6 weeks, or maybe 2 months over August, and we will begin a new webinar series, and it will be with the Community Toolbox based here at the University of Kansas. Feel free to look that up on your website. You will find that have just so much information, so the same depth of information that CADCA offers. We will have the next webinar on Tuesday, September 19th. It will be advertised through ANO, the Oral Health Coalition Networks. It will also be advertised on the ASTDD, I guess, Monday section. And again, you may just follow up and ask us at Oral Health Kansas about how to log into that. So we're looking forward to it. And again, I cannot thank enough the talented people at CADCA. Dave represents them, but they have such a wonderful, rich, diverse staff who've been working for years to work with all of us on dealing with, I mean, every time we seem to have another year, we've got a different kind of drug or tobacco or alcohol issue. So thank you to them. Feel free to go to the CADCA website. Again, you'll see lots of printed material there, lots of resources. And so Dave, Renee, Carlton, thank you very much for being our partner. And we will look forward to maybe hearing from you again.
We do have a couple.
We do have a couple of questions
who have raised their hands, and so if you like, I could try to unmute a couple people to ask questions. So Jan in Arizona, I unmuted you in case you have a question.
Oh, I didn't. I was looking for the handouts. I'm sorry.
Got it. Okay, no problem. No problem. And then Judy Volby, I think your last name is. You had your hand raised too. Do you have a question?
Yes, I was just wondering, as you're trying to gain attention and support for, your dental organization or coalition, are there certain legislative agendas that you have or initiatives that you have taken on that you can kind of get group support on? I know there are sometimes the ones that cause controversy, but are there certain, initiatives where you've gotten support, across kind of the spectrum, and it's been a way to gain attention and recognition of what a coalition can do?
Hi, this is Marcia. Let me tell you what I am finding. I was saying to our team here at Oral Health Kansas that I go to a lot of candidate forums, and I've been interested when I always introduce myself, tell them who I'm with, how the number have said oral health is so important, it affects our overall health. I think that is one of the key messages that we are now getting out, that it triggers strokes, heart attacks, certainly affects digestive systems. One of the things that's always a surprise is that it can affect preterm low birth weight babies. So we're getting that kind of message out to people, and there's some really good materials and graphics online that we use a lot in our workshops about how it affects. We also have switched to say how much poor oral health affects the challenge for the child to be successful in school, to be good learners. And so we begin talking about how we're working with pregnant women and infants and toddlers to ensure that they have good oral health for life. So those are the ones that seem to catch the attention of candidates and legislators that we're talking to.
Yes, I think the reason I asked that, and I think that's true, and I have tried to gather some of that information available, because I think one of the things we find when you're a part of coalition is that when we're trying to get, as the state's divvying out the money on what they're going to give Medicaid and Health and Human Services and that type of thing, you know, the more that oral health is funded through the legislature, the more chances it is that a coalition can grow its members and grow support and be influential in that process. So I would be curious to maybe talk with you offline at some point, you know, about more of the specifics around that, because I'm looking for something that everybody can get on board with that doesn't cause necessarily controversy between the dental professionals, you know, and yet it's something that everybody can get on board for, and we can get better funding through the state legislature for oral health.
So Judy, this is Tanya Dorf-Bruner here with Oral Health Kansas. I appreciate your question. We work with our counterparts at the other statewide oral health coalitions all over the country, and pretty much every time we talk with all of our counterparts about what are the issues that your coalitions are most interested in, what are the issues you get the most traction on, that you keep everybody at the table talking about, the two issues that come up over and over and over again are either getting or sustaining a full dental benefit for adults in the Medicaid program, or again, getting or sustaining community water fluoridation. Those are really adult dental services and Medicaid, and community water fluoridation are the two major issues that nearly every single statewide oral health coalition in the country is focusing on and tends to get good traction on, and like I said, does keep all the different players at the table and interested together. So I don't know if that helps kind of what you're looking for.
No, yeah, that's all helpful.
Okay.
Yeah, and we haven't gone that route. Thank you.
Sure. I was just saying that the one last thing that I'm picking up again from what Dave said is that every legislator has an issue. We have no idea if the legislator's mother has dementia. We have no idea if the legislator's daughter or the legislator herself might be pregnant. We don't know if their children are enrolled in school and there is no dental sealant program coming into the school. So part of it, I think, is just getting to know people personally and what might exactly respond.
That's a great question. Thank you.
Thank you.
With that, it is just 1 o'clock. Thank you again, everyone. Please remember to do the evaluation, and already mark your calendar. What did I say? Tuesday, September 19th? Thank you very much. Dave, Renee, Carlton, thank you again.
Thank you. It has been a pleasure.